When we think about exercising and we think about stroke, we often think about how would one be able to walk if someone actually had a stroke and that body doesn't work. Brain is considered to be extremely plastic, and there's a lot of evidence for neuroplasticity in the brain post someone who has a stroke and when exercises are performed for them. It is based on these 10 principles, which include use it or lose it, which basically means you either use that body or it will never work for you. So it becomes extremely important that if someone has a stroke, we encourage them to actually use that part of their body. The more you use it, the more it gets improved. We want to be very specific, which means that you don't want to just do hand movements up or down or your shoulder moving up or down. You just want to make sure that the movements are also very specific. For example, someone should be practicing moving their hands towards reaching out to get a glass of water or trying to read, rather than just bringing your arm up or down. Then another important factor that will help improve that brain synapses or these connections within the brain to help the brain function better is repetition. More the repetition, the better the outcome it is, and how intensely we work. The stronger the intensity is, the better the outcome, like I previously discussed. Time matters. The earlier you go and get your rehabilitation done, the better the outcome will be. It's been often noted, patients sometimes can take a very lengthy time to actually get to a physical therapist or other healthcare providers to get their intervention started. If you're healthy and you are medically cleared to perform physical therapy or occupational therapy, it is best that you start early rather than wait at home. Age matters as well. Younger you are, better the brain is, the better the plasticity of that brain is. Finally, we want it to be motivational for the person who has experienced a stroke. Once things don't matter to us, we don't tend to do them. So if you are experiencing a stroke, if you are someone who wants to recommend stroke interventions for someone, just make sure that they are meaningful to this person. So that's why salience actually matters. Transference. If you just did the bike, you won't be able to walk. It's a very important principle. It basically means that the more you practice the things you want to really do, that's how your brain will shape up. If you actually want to walk a lot, you need to walk. If you're not going to walk and you just think about doing a bike or maybe just doing some leg exercises, it won't really improve your ability to walk. It'll probably get you stronger, but it won't really improve the ability to walk. So it becomes very important that the tasks become very specific. Interference. There are some things that we already know from before that can interfere in making us learn these new things. After someone's had a stroke, the key thing is this, that you have lost the function to perform that activity. And once one forgets how to perform that activity, one tends to use the good side to do those activities. Now, consistently using the good side to perform the activity will not really allow one to learn how to use the side that is affected. So for example, if someone actually has a right-sided stroke, which means they have resulted into right-sided hemiplegia or hemiparesis, which means your right side of the body is not working, whereas your left side of the body is working. So for most tasks like combing your hair, picking up a glass of water, there's a high likelihood that someone might use that left side of their body. And that consistent use of that left side will really hinder one from learning how to do their right side exercises. So it becomes important that right-sided exercises or use of those exercises on the right side of the body is done early on. Then the next thing is, I know when I'm going to start, at least 24 hours after the stroke has happened. We know that the brain is very plastic, so there's a lot of hope that patients will improve. And as you know, about 60 to 80% of our patients will be able to walk. People who have stroke should be given this data to share that, there's good hope for someone to be able to walk and be able to live their life. We have learned how to do prediction of the outcomes for our patients. Or if you are someone who's living with a stroke or you care for someone, you know what are the key factors that can affect someone's outcome for stroke. And now what becomes important is, what kind of exercises should I recommend, should I perform in order to help improve that function of that weak limb? So there's again a lot of data that we have and a lot of evidence that supports that aerobic exercises, or the exercises that really improve the cardiovascular system within the body, should be performed. The exercises include like treadmill, walking, you have your overground walking, which means just walking on the ground, and water-based exercises, which as long as you're medically stable and safe, you are allowed to do exercises in the water, and they're called the aquatic-based exercises. You can also do a bike that can help improve the functioning of that heart and lungs. Use of an arm bike, where instead of using your legs, you will use your arms to improve the heart rate, and you will help to improve your lung function. And then comes a combination of both, maybe using your hands and legs while you're sitting down and moving them in a biking motion. And finally, you really want to do some of that functional training, and in a more intense manner. So if you do sit to stand 20 times compared to sit to stand once, and you really put in a lot of effort and you do it fast, you will really train that heart and your pulmonary or your lung system. And all of that is found to be really effective for people who have had a stroke. There are certain guidelines that one should follow when it comes to aerobic training in stroke. Usual recommendations include that more than 3 or at least 3 days per week, about 20 minutes to about 1 hour sessions should be completed while we are performing these different exercises on the treadmill, on the bike. And the rate of perceived exertion, which means that how exerted do you feel, can be done on a scale from 11 to 14, which is working out between light to somewhat hard exercises. Graded exercise testing should be performed before you want to recommend highly intense exercise regimen. Graded exercises testing means that when the exercises are performed, the patient is being monitored throughout, and you're looking at the responses of this person who's had a stroke, just to make sure that they are safe to perform high-intensity exercises. If those testing have been completed, graded exercise test can be performed from between 55% to 80% of the max heart rate. And in case no graded exercise testing has been done, these exercises, that is the aerobic exercises, should be performed at a slightly lower intensity, between 40 to 70% of your predicted maximum heart rate. And how should we progress these exercises once we have decided they should be done about 3 times a week? They should be increased between 5 to 10 minutes every 1 to 2 weeks for the first 4 to 6 weeks. The intensity can be increased by 5 to 10% based on your heart rate reserve every 1 to 4 weeks. And always remember that the heart rate, blood pressure, your rate of exertion, how difficult the exercise is, must always be asked from the people who have suffered from a stroke. Any exercises, when done without monitoring, can be very harmful for someone who's had a stroke. There are different outcome measures which physical therapists or even occupational therapists can use to see how much the person has improved. They include walking for 6 minutes, looking at how fast you can walk at this time, and also being able to count your daily steps that you take. Then becomes important, given that the body is not working as before, the muscle strength has definitely reduced in this person. It becomes important we strengthen those muscles, and these exercises are called resistance exercises. They can be done through free weights, they can be done through use of therabands. They could be done with the use of equipment that you can find in the gyms. Along with that, you can also do certain exercises that involve your own body weight, which means doing sit-to-stand exercises, rolling out of the bed, trying to do a sit-up position. And these exercises, when training with your body weight, can also help you have higher amount of muscle strength. The evidence, as it suggests, that when you do these resistance training, it significantly impacts the amount of effect one has, which means that the selection of exercises is very important. Do you want to do free weight or do you want to do an equipment base? So based on the protocol, the success will be determined. Though the literature is mixed, which means that some would say there's a significant improvement, some would say there's somewhat improvement, there still has been found to be evidence that there is improvement in your motor function, that is your ability to use that limb that is not working post the stroke, your ability to actually walk better, improvement in balance, improvements in one's walking speed, and also their quality of life. It's very important that intensity will help improve that neuroplasticity in the brain. So higher intensities have been found to be more superior than lower intensities. Flexibility training. Most of us sit, and most of us tend to be less flexible as compared to when we were kids. Now, as we age, the flexibility tends to get worse. And when one gets a stroke, the tendency to become flexible can become even worse because this person might tend to stay in bed. This person might not be able to walk. So the muscles don't have their normal stretch to them. So flexibility training can also be given to this patient population. And what we have noticed is that sometimes, because when one cannot walk, there is something called a contracture. Contractures are nothing but tightness that's found within the muscles, or it has become so tight that we cannot improve the range of the motion of that joint. There is some guidelines that have been presented by American Heart Association or the American Stroke Association. We'd want to stretch out the trunk, the upper extremity, and the lower extremity. We also want to do static stretches at least for 10 to 30 seconds, which means if I have stretched my hamstrings, at least hold it for 30 seconds. You want to do them 2 or 3 days per week. If you consistently passively move this person who's had a stroke, which means that I'm the person who's always stretching this person out, there's not much evidence to it. So encourage your patients to have flexibility exercises and try to do them as much as they can on their own. Balance training, a big challenge for people who have had a stroke. They can have a high risk for falls because their body doesn't move the way they want to, and it becomes extremely important that we train them for balancing. And there's again a lot of evidence that supports different kinds of balance training. Perturbation balance training actually has the highest benefit when it comes to improvements in quality of life. Dual task balance, which means that most of the times as humans, we don't just do one task. I am talking to you, I'm also looking around my environment and consistently thinking, and I am standing. However, if someone has to walk and cross the streets of New York City, it becomes an extremely important challenge for them. And sometimes people who have had a stroke don't manage so many multitasks as their day goes by. They might start off well and then it gets worse, or others might not be able to do that multitasking. So dual tasking means we are picking up 2 tasks for them, such that they are standing and maybe counting numbers. So dual task balance training is also very important to improve that functional ability compared to just having them stand and perform the balance exercises. Wobble boards, which is nothing but a board that helps you wobble and you have to fight to find your balance. It is found to be better than just doing standing and balance exercises. So use of equipment really promotes improvement of that neuroplasticity. And sometimes you can use transcutaneous electrical nerve stimulation, which can also improve their balance training. This electrical stimulation is not painful. This electrical stimulation can be provided to the nerves that are supplying those muscles. And as they're performing their balance exercises, we are providing that increased stimulation to that nervous system so that they can help fight for their balance. We always want to remember that balance training is an effective form of intervention in order to improve someone's dynamic balance, which means if you walk on uneven surfaces, there's a high risk for falling compared to if you were just standing. So considering balance training in people who have had a stroke is an important component that the physicians, healthcare providers, and caregivers should keep in mind.